I'd like to welcome everybody to all of our guests, and Dave will say hello a little bit more in depth in a moment. But thank you to everybody who's watching this evening and taking part in at least listening to our expert speakers and listening to what Dave has to say. We're talking about healthcare tonight, which is a massive topic. So we've narrowed it down a little bit to focus on a few items, which Dave will talk about later. But we thank you very much for coming. So the first thing we want to do is acknowledge and honor the land upon which we gather today as the historic and traditional territory of First Nations peoples. In particular, we recognize and thank the Neutral Nation, the Mississauga, and the Haudenosaunee for their stewardship of the lands over millennia. May we live with respect for this land and live in peace and friendship with its people. My name is Sonia Regier. I'm going to help start everything off tonight and close a little bit. But the main part of our evening this evening is with Dave Augustine, who is our NDP candidate for Niagara West. We also have joining us Carrie Seguin, who is a midwife. She's been a midwife for 18 years and actually helped to open Lincoln Midwives in 2011 to help serve West Niagara. She's worked with thousands of families in the region and helps them learn to advocate for their health and make informed choices that are best for them. So thank you very much, Carrie, for joining us this evening. We're very glad you're here from the midwife perspective. We also have a registered nurse, Tammy Robertson Chouch, has been a registered nurse for 32 years. The last 20 have been in Niagara, working in ICU, OR, and the heart investigation unit. Prior to being here, she was in Hamilton Health Sciences in the CCU for 12 years and is back now, very happy to do that, and has had the opportunity to learn and listen from patients and doctors and nurses and families, and has a really well-balanced view on what's happening in healthcare. So we're very glad, Tammy, that you could join us with your 32 years of experience. So we have a lot of experience in this panel this evening, my goodness. And then last but not least, we also have Brenda Allen joining us. Brenda is an occupational therapist and currently in OPTU Local 215, which she's been doing since 2013, representing a diverse group of essential frontline hospital professionals, including laboratory, medical imaging, respiratory, mental health, rehabilitation professionals, to name a few. She's also chair of the Niagara Area Council for OPSU within Niagara and the treasurer of the hospital professional division, serving all OPSU hospital professionals across Ontario. So Brenda, thank you also for joining us. We're very happy to have you. And of course on National Day, which is also nice. So Dave gets to be surrounded by women this evening on the panel. And of course, Dave Augustine, who has, I would say, is pretty well known in Niagara West. He's been mayor of Pelham for 12 years, has been involved in a lot of fantastic initiatives to help the community, from Wellspring to the Meridian Community Center to all sorts. So Dave is now taking on, hopefully becoming the next MPP in Niagara West on June 2nd. So Dave, thank you very much for hosting this and leading the discussion this evening. I'm going to pass it over to you. I just do want to say that our guests today are sharing an important discussion based on what they have experienced over the course of their career from lots of different aspects, but more importantly, it's being seen and heard from various parts of the province, on different social media platforms and in print media. So their contributions today are theirs alone and are not necessarily reflective of a larger group. So just wanted to mention that. Okay, Dave.
Wonderful. Thank you so much, Sonia. Really, really appreciate the introduction. Thank you for introducing our guests. Thank you for doing the land acknowledgement and also pulling all of this together. Thanks to each of you for being here, those that are watching, but also our very, very special guests. Our goal this evening on International Women's Day is to hear about healthcare. And it's, as Sonia mentioned, it is a very broad topic, but it is a profession that is dominated by women. dominated by very strong women, as we have this evening and we're going to hear from, but also a caring profession, a profession that is so much needed, and the pandemic showcased that. And I think we're going to hear a little bit about that. And we're going to hear about the impact of a government that maybe doesn't, well, I'm going to say it doesn't honor the women in the profession. It doesn't honor those in the healthcare profession enough. And I want to hear a little bit more about that and what we might do as in the Ontario legislature to honor our healthcare professionals. So thank you very much for joining us on International Women's Day.
Thank you.
And I'm going to turn it over to Carrie to talk for a few minutes and give us some information. And I will say, as I'm saying this, but I'm here to listen. And I think those that are watching are here to listen. We're here to listen and learn and try to get the information out and the stories out about your experiences. So thank you very much. And I'll turn it back over to Carrie. Thanks, Carrie.
Great. Thank you, Dave. Thank you, Sonia, for this opportunity. It's pretty exciting, a little nerve-wracking, I must say. This is my first roundtable, so here we go. So like Sonia and Dave mentioned, my name is Carrie, born and raised here in Niagara, and I've been a midwife here for 18 years. So originally started out in Niagara, and then my partners and I opened Lincoln Community Midwives, like you mentioned, Sonia, in 2011, serving West Niagara. Like most probably know, midwifery is a new old profession, so it has existed forever, but has only been legislated, I must add, by the NDP provincial government. January 1st, 1994 is when we were legislated here in Ontario. We were the first province in Canada actually to be legislated. And we provide primary care for people during labor or during pregnancy, labor, birth, and 6 weeks postpartum for clients and their babies. So just a little bit of a background in terms of, midwifery is funded by the Ministry of Health and Long-Term Care. So that means there is no out-of-pocket fees for clients seeking midwifery care. And we hold privileges or hospital privileges and order any necessary laboratory or diagnostic services needed through the pregnancy, labor, and postpartum. We base our care, I think the care that we provide, I would say, is pretty unique, and we base our care on 3 pillars. That would be continuity of care, informed choice, and choice of birthplace. So clients coming into midwifery care will meet a or a couple midwives, meet them throughout their pregnancy, build a relationship with them, and then they will be familiar with the person who attends them in labor and then throughout the postpartum. So that is a really nice aspect of midwifery, knowing who's going to be there to support you through labor, birth, and postpartum. Another really important kind of pillar, I think, to midwifery is informed choice. So the client is the center of the care that we provide. So we provide as much information as we can to people, pros, cons, risks, benefits, up-to-date studies, in hopes that clients can make decisions about their health and their babies as much as they can, and we support them through those choices. And then lastly, choice of birthplace, obviously, is probably the most unique of midwifery. So clients who have a normal pregnancy can choose to have their babies at home, as long as there's certain parameters in place and it's attended by a registered midwife. So those are kind of how our care is shaped, which is really nice. I think healthcare workers in a whole are important because they are often working with a specialized skill and doing the job of caring for people in our community that are probably often the most vulnerable. And that is really important, I think, for everybody in a whole, not just midwives. The majority of healthcare workers, like we did mention, are women. And I think, being International Women's Day, it's important that our voices be heard about pay equity and recognizing the vital role that we play in our community, because we know that women dominated professions are frequently underpaid and unappreciated. It's interesting, I was pulling out some numbers about midwifery, and so our profession is one of the professions in healthcare that is experiencing a large burnout and attrition rate. So when we were legislated in 1994, we had 60 midwives. And so there's a study that was done in 2019, so that's 25 years later, there's only 1,700 midwives in Ontario. So, it's just, students aren't even getting through the program because of how demanding and how the kind of role of midwifery and the model of midwifery is shaped in this province. I would say, just like fellow healthcare workers, reasons for burnout and attrition are the same across the board. So, especially in the last 2 years, we've been stretched pretty thin in terms of, covering co-workers. We've seen lots of nurses on our unit, having to come in early, stay late, revamping their holidays, not being able to do what they had originally set out to do. So that's a little bit frustrating. I think, one of the questions was, how can we appreciate healthcare workers? And I think, reducing work-related stresses would be one of the things that, first came to my mind. And one of the examples that we pulled out is at the beginning of the pandemic, midwives experienced a real lack of resources and a real lack of direction in terms of how to obtain, the simple, how to get PPE. But then also being encouraged to try and keep clients out of the hospital as much as possible. So how do you do that? How do you not have PPE, provide safe care, provide safe working environments for midwives and keep them out of the hospital? So, we were pretty desperate at the beginning, to be honest. Like, we were sewing our own gowns. We had clients delivering gowns to our door to make sure that we were able to provide care. We had husbands of midwives making visors on 3D printers because we had nothing else to, had no other resources in terms of how to obtain proper PPE. So as you can imagine, that was very stressful. And I think one of the reoccurring themes for midwives in terms of being recognized and, reducing stresses would be to receive timely budgets, I would say, is kind of on the top of our list. So, midwifery is funded by the government. We run on a fiscal year, so April 1st, so say this fiscal year is April 1st to March 31st for 21-22. We submitted our budget January 2021, and we are now 23 days away from the end of the fiscal year, and we've yet to receive approval for our budget. So what that means for us is that our waiting lists are large. We cannot hire the midwives that we're looking to hire to help grow the practice to be able to provide services to our community. So I would say that would probably be at the top of our list in terms of frustrations and how we would like to be shown a little bit of appreciation and be able to serve our community the way we want to and the way we need to. So
thank you.
And I think that kind of sums up where we're at in terms of midwifery in West Niagara. Our waiting lists, as it's very unfortunate in our area because of the closures at West Lincoln. We've lost many family doctors who did obstetrics. And so now I think we're seeing that increase in demand of clients where we have upwards of 30 or 40 clients on a wait list monthly and unable to serve those people because we're still working with 2020-21 budget numbers.
Wow.
Yeah.
And babies don't wait.
Babies don't wait.
Thank you so much, Carrie. Really, really appreciate you giving us that. I know there's so much more there and then so much that you can cover. but thank you so much for explaining that so succinctly and explaining your experience and letting us know. So I have a bunch of questions that I think will probably be themes through all of this. So I'm now going to turn to Tammy, who's going to give us her experience and talk about nursing.
Hi, so I'm Tammy, and I've worked for 32 years and mostly in critical care. So I work with a lot, obviously it's a high stress area. So I just wanted to, this is my first roundtable as well. I have done one other Zoom meeting for a research study that I was doing in cardiology. So bear with me if I stutter or stammer. So it's all over the news right now. I don't know, the headlines that nurses are getting $5,000 incentives to retain nurses in the hospital systems in Ontario. So this is a Ford-driven incentive to try to buy back votes, like he did with $1 a beer back in his previous campaign, to make himself look good in the citizens' eyes of Ontario. When meanwhile, nurses aren't doing our jobs because we want a $5,000 tip. And that's kind of how it feels. And I feel the blogs and different groups that I belong to, that we're finding it really kind of insulting, actually, because we are more about wanting adequate pay, wage parity and working conditions. We're all about safe patient ratios and approved vacation, so people can book their cottage in their time with family, and they're unable to do that as of right now because you never know if your vacation is going to be approved or taken away. You put a deposit down on something and you might be out that. And it's happened to people I know in different hospital systems throughout the province. So the $5,000 in retention bonus really is, he's backpedaling, and I find it insulting, frankly, as a professional nurse. I didn't ask him for that, nor will I say no to it. We'll take it, but he's turned down $900,000 for the 407, and something else was in the news the other day. It was literally just under $1 billion in tax money that could have come
stickers, in. The license plate stickers.
Okay, right. I mean, I can pay for my stickers, and all my neighbors said that they can pay. Everyone I know can pay for their stickers. We'd rather have good health care. I'd rather not have to pay for a doctor's appointment. I'd rather be able to get a doctor's appointment when I need it. I'd rather have nurses that are adequately staffed, because not only am I a nurse, I'm a patient. I have family members that are in the system. My mom is in long-term care. So I see the exhaustion on staff's faces, and it really is frustrating because we've been undervalued for far too long. So, and the important numbers, so we're talking about this $5,000, but the important numbers that we need to talk about is the raise, and the fact that our income has not kept up with the cost of living increases for, we're talking 15 years, it hasn't. So 15 years, half of my career, I haven't had the cost of living in my budget, basically, to keep up with the cost for tuition, housing, gas, tuition for my daughter to go to school, and all those things. So Bill 124 caps my salary further, and it at the 0.9%. When you look at everything went up this year, my nursing license registration went up, my union dues went up, parking went up at the hospital. I think we pay annually, nurses pay $700 a year in parking to park and to do a job of servitude. Like, and I hate to think of it that way, but I don't think police and fire, I don't think they pay to almost $1,000 a year to park their vehicles to go and work in their publicly funded jobs. But nursing and healthcare workers, and that goes for the housekeepers at the hospital, the MRTs, our RTs, the lab pharmacy, it goes for everyone. But I don't think that that is something that necessarily we should be taxed with when our wages have been capped. And I know that often the MRT, the radiology, their contracts often follow the nursing contract, and same with the respiratory therapists. So if the nurses are not getting adequate raises, nor are the allied smaller health professionals that we rely on heavily to keep patients alive and do the diagnostic testing that we need. So you freeze our wages, and it's really in the cost of groceries, the cost of gas, everything's gone up, and we're paying for parking. And so basically the nurses of Ontario have been bearing the burden of the Ontario healthcare budget for decades, and by doing so with wage suppression. So Ontario also, the numbers we should be looking at is Ontario has the worst RN per capita in all of Canada. So that ratio reflects the RN per citizen. We are 22,000 registered nurses short in our province. That is like combining the town of Beamsville and Lincoln together, and you would come up with 23,000. Niagara-on-Lake, the whole town of Niagara-on-Lake, basically we need registered nurses in Ontario to bring us up to par. That's a really sad statistics, because as we know, the old nursing ONA nurses do know. We know when patients are taking a turn. We know when we see these small little subtle changes that we can tune in, and we call our doctors and we call the RTs to come draw blood gases, and we call the MRTs to come up and do a chest x-ray because we know the patients are in failure. If you don't have that nurse, the registered nursing staff at the end of that bed, no one is going to, the nuances, the changes, the subtle changes, no one's going to get notified until maybe it's a bigger event. So you're looking at, someone going into heart failure or whatever it could be. Instead of being reacting in a controlled manner, you might have something that might be more of a bigger event. And I think as Canadian and as Ontarians, we want better healthcare for our loved ones. I want better healthcare for my loved ones. And I think we should demand it. So these cuts have really wounded us. And so I think registered nurses are leaving the province. And I think that we need to really empower the nurses to stick around. And the only way we can do that is with fair negotiations, wage parity, vacations that are approved so that we can have that normal work-life balance that will help reset our stress levels and allow for some decompression with dealing with in the last the last 2 years. But it's not only that, nurses have been denied vacation for years prior to the pandemic. This isn't just a new problem. So it's shocking, really. And I don't know if many people actually acknowledge that. Combining the different hospital system strategies of hiring part-time staff, which denies them paid vacation or sick time, which we saw as a huge problem when nurses were trying to self-isolate throughout the board. It didn't matter if you're from Ottawa, Sarnia, it was everywhere. That nurses have been kind of parted out. Instead of coming up with full-time lines, they hire part-time. And this is not just, I know they did this at the LCBO, and I'd like to think of the hospital and nurses as and RTs and MRTs as more valuable to the province than, and I know that they also they serve a purpose, but we've gone to school for years to have our craft and our skilled knowledge base. So we really feel that the hospital, if there's a line and nurses are working full-time for 9 months, perhaps they should look at creating a full-time role in that area and come up with a budget somehow. But the thing is I guess provincially, we need someone that is going to be there to advocate and say that we need to have more full-time staff so that when a crisis like the pandemic hits, we aren't as short-staffed and we're not being so reactive to the needs of the departments in ER or wherever. So anyway, you notice that fire is never hired part-time. Fire is only ever hired as a full-time line. And so that's interesting in itself. So yeah, so anyway, and police, I don't believe there's many police. I know very little about police services, but I do not believe that there's a lot of part-time police. But at the hospital, we're part-timed out like it's going out of style. the other thing is nurses that work in critical care or advanced practice within the hospital setting, there's nothing to incentivize nurses to advance their career choices to go work in hemodialysis, the OR, ICU, PEDS ICU, even more challenging, burn trauma units. It doesn't matter, heart investigation units. We don't actually have an increase in wage for anyone that has increased skills. So you obtain this extra knowledge, and you do so just basically for personal challenges and trying to further your career and your knowledge base. But there is no incentive to actually advance your practice, which it's very oppressive and kind of it's very outdated. And we need to look at that. The added responsibility that usually goes with these roles needs to be financially rewarded. And I think that nurses in these areas work under a lot of stress consistently, and they need to have financial benefits of that. So, and I think that if you advance your skill in it as a detective, I believe that detectives get paid more than a first-rate officer or entry-level officer. And I would imagine that the sergeant gets paid more than a detective. And so you've got your nurses that work in triage with all the added stress that they work in ER, or even charge nurses. They're nominally paid to juggle many balls as a charge nurse. And I find it's basically shocking that they're doing these roles basically just because they either have the motivation to be a leader, but they're really not financially rewarded for any of these added stressors. So
Tammy, thank you so much for making those parallels, especially on International Women's Day. I do want to get to Brenda. So is there anything you just want to quickly close up on, if you don't mind?
Basically, well, I just believe that nurses have been underserved for many administrations. And I believe that it's time for us, the pandemic, it's time for us to really look back and see where we can make improvements, where we can make wage parity with police and fire. You know, the days of us being compared to a pastry chef are long over. We have skills, we are a profession. We don't do this just out of the goodness of our heart. And it is a calling maybe, but we are a profession, and we should be deemed and treated as professionals in healthcare, experts in our field.
Wonderful. Thank you. Thank you so much for sharing all those. And again, those examples and comparisons. Yeah. Thank you so much.
And I was at Sam Oosterhoff's office petitioning Bill 124, and we need to get rid of that bill, and we need him out, and we need some new inspiring leadership.
Thank you. Well, that's why we're here. I'm listening because I want to be that inspiring leadership, and I want to make change in our riding and across the province. So thank you so much for that. And obviously, yeah, Bill 124 is certainly something we can talk about, and we definitely want to repeal. Brenda, you've been very patient. Would you help us out here as well? And hopefully we don't have any technical difficulties with you. So.
Yeah, absolutely. Thanks so much for having me here tonight, Dave. I just want to start by saying absolutely thanks, Tammy, too, for highlighting some of the professions that I represent. I'm an occupational therapist by profession and worked as an occupational therapist in Niagara Falls for a good 20 years before stepping out into a full-time president role representing so many allied health professions. My biggest challenge is giving them all a good shout out, which is a real challenge. But from, the moment a patient comes in the doors of the hospital to like the lab assistant drawing the blood to the lab technologists who are, processing those blood tests that are so urgently needed for diagnosing patients, from all those added COVID swabs that were processed over the last 2 years, it's just incredible. And that's certainly one profession that is undergoing severe recruitment and retention issues is the lab technologists. I actually just saw today a reference that said that 73% are looking to leave the profession. And it's burnout. And I think that this pandemic has highlighted a lot of the issues that, like Tammy said, have been there all along. But yeah, so I represent those folks. I represent, as Tammy referred to them, the MRTs, but we have registered technologists that work in X-ray, ultrasound, CAT scan, MRI, nuclear medicine, mammography, bone density. Like there's just so many echocardiograms in the HIU with Tammy. There are registered technologists working side by side. And then along the healthcare journey, like we have to help diagnose the for the doctors and the patients. And then we also need to help treat and rehabilitate those patients. So representing the OTs, the occupational therapists, who are often, the forgotten profession beside the physiotherapist, maybe who's a little bit more well known, and recreational therapy and speech language pathology if you're not swallowing after you've been extubated from the ICU. And our ECG technicians are in the ICU and all over the hospital doing ECGs and supporting. I know nurses also do some ECGs. So we have a lot of folks. I represent the infection control practitioners who, monitor the infection control practices and provide guidance in the hospital, and the biomedical technologists who ensure that the equipment we're using for life-saving events are actually functioning well and functioning properly. So without all these highly skilled, highly trained professionals, where would we be, right? We wouldn't have the quality care that we need for Ontarians and for us in Niagara. And it's really that team effort, right? As Tammy said, like workload is an issue. And over the years, since the time I began in 1993 at a much smaller wage, but since that time, we've just continually been stretched. Healthcare has been stretched thinner and thinner and thinner, and expected to do more with less. I can tell you absolutely 100% that every healthcare professional I represent goes into work and is working at a high pace all day long. Like they are, it is stressful. It is, there is this expectation that we're resilient, and we can only be so resilient under those working conditions. And at some point, the working conditions need to change. We need to have more resources, more staff, better patient to staff ratios so that we can provide the care that we as community members of Niagara deserve, and Ontario, right? So certainly workload and work pressures is a huge issue. It was an issue before the pandemic. It was highlighted throughout the pandemic with the legislation and like Tammy mentioned, schedules being changed, vacations being canceled, people needing a break and a breather and not getting it. Terrible, the ratios really between full-time and part-time were accentuated. I know in some of my disciplines, there literally was no other option but to take those part-time jobs and convert them to full-time jobs. Because if you need full-time committed employees, there's really only one solution, right? So we did see some conversion of part-time jobs to full-time. But let's also remember there's people out there who really do appreciate part-time work as well. Maybe they have other life priorities and families and things like that. But people need their vacation and they've been stretched to the limit. I would say, in thinking about the professions I represent, they feel undervalued. They're not looking for over-the-top recognition. They're not looking, for huge shows of appreciation. They're just looking for what Tammy said. They're looking for respect for the training they have. We have a lot of young workers coming into healthcare now. They're coming in with huge amounts of educational debt that they need to pay down. And they're looking at their wages saying, like, what's going on with these wages? They're contemplating traveling healthcare work in the US. Great option to pay down that debt. Yep. So if we want to retain our highly skilled workforce, we need to do something, and we need to do something quickly to retain them in Ontario, in Niagara, where they really want to work. That's their first choice. But, let's look at the prices of gas, the prices of housing. Like how do you foresee a future in Ontario when you're not being recognized for the work you do and you're not being paid according to the work that you are highly skilled and trained to do? It's tough for these folks. Like I think that, for my members, and I appreciate Tammy saying about the $5,000 bump, of course you're going to take it and well deserved. But, in OPSU, a lot of people are shaking their heads saying, So you put in Bill 124, you capped our ability to bargain through the normal process. And now, a couple of years ago, you handed out some pandemic pay, but Mr. Ford, you said to us you didn't have enough money to make it go around to everybody on the front line, whether we're standing beside the nurse or the, you know, kitchen staff, you know, who are getting it. All well deserved, but so many people were left out. And so now, forget just basic recognition. People are undervalued and feeling invisible, like, and wondering why these decisions are being made, right? You've put something in to cap proper bargaining, and now you're handpicking certain groups to receive certain bonuses, and it's the inequity. People want to be treated with respect, and respect also reflects being treated with fairness. And Ford has not provided respect and fairness to the healthcare workers of Ontario, and that I strongly believe. I sometimes wonder really what thought process is going in his mind, but you know, I think Tammy aptly put it that he's buying votes. You know, I'd rather pay for my license plate. I don't need a bucket of beer, and like I don't know what else to say about that. Like I just, yeah, we need change, and Dave, hopefully you are that change that Niagara West will see. And
So too, yeah.
yeah, I think that's it for
We
me
have to
for
change
now for
things at the
me. I
province.
mean, I could probably talk for an hour so about various issues. So
One,
yeah, yeah.
I
So
forgot one very important thing to mention, Dave.
okay, and then we'll kind of open it up. I know
Okay,
Carrie might want to add to
forgot,
some of this.
and this is the, well, I don't want, I missed it. I didn't get to it. Was about retention for senior nurses or mature nurses. I'm not going to call them senior, but our staff that have all the skill sets that need to mentor the younger nurses in the wings that are coming in, the new nursing heroes.
Right.
If I knew everything I knew at school, my practice would be tiny, like very tiny. It was the nurses, the expert cardiology nurses in CCU at Hamilton that helped me understand the heart rhythms. And, you know, and they balance the assignments for the charge nurses and the nurses that are making those decisions on who can handle what patient. We put a junior staff with a senior one next to it. And it's not done like that just by coincidence. It's done like that so they can support and lift that nurse up and help them to develop those skills and hone in and learn and advance their practice. So without mature healthcare professionals that are going to be able to raise up the next level, the next generation, they're going to be stunted. If we have all junior nurses in the ER or in the OR or in ICU, we need the mature nurses. So we need to retain them, and we need to attract them back with security and appreciation. So.
Thank you. That's a great point. And I think of other professions there, even apprenticeships, right? That's the whole model. And so we're not doing that model in nursing, as you're saying. So wow, thanks so much to each of you for explaining these. I mean, there's so many things here that I know we could talk about. You said, Brenda, we could talk for hours. Yeah, we could talk for hours and understand it. Some common themes that I'm definitely hearing is lack of respect, is I mean, the way you said undervalued, feeling invisible, those are heart-wrenching. Burnout. So if you could just talk about the suggestions, how do we, it isn't the benevolence of the premier that comes in and says, here's $5,000 or here's this, right? You're looking for something different. You're looking for respect, is what I'm hearing. Carrie, do you want to add to any of that? You started us off. Is there anything about that element of respect, even the budget that you're not getting proposed? You can't plan ahead to help those babies that are on their way. Would you care to comment a little bit about that?
Yeah, I think Tammy hit the nail on the head with, comparing other essential workers like the police force and all male dominated professions. And, that's what hit home to me I think the most was, it's so true, and it's so eye-opening in terms of, those very good pay levels, and, how nurses and, most, essential care workers don't get valued the way that probably they should. So yeah.
Yeah, you mentioned pay equity. Is there anything else to add to that, Carrie, and then the others? But I do want to hear about, because I don't think the firefighters and the police officers are not in Bill 124. They're not covered, right?
No.
So I see Tammy wants to go.
I want to talk.
Go ahead,
Okay, I can hear. I don't want to cut off Carrie though. Carrie, what did you mean? Just quickly, what did you mean by pay equity? Carrie, for pay equity?
So it's interesting. It's really interesting when you look at Bill 124. It's almost like whoever drew up this bill, and I'm thinking it was a group of men in a room somewhere. They surgically excised the male-dominated professions of police and fire, and by no means is this a slap or disrespect to them, because I love all of our community social, like I love police and fire. It's not a disrespect. I do want to be included at the table though. I want my time for my profession. I love nursing. I love I've always been a nurse's nurse, where I try to uplift nurses around me, empower them. But it's hard when we're constantly feeling berated, and we're taking always the hit. And I remember the union the last time saying, we'll get them next time. We'll get them the next time. Well, we did not get them the next time, and we didn't get them next time after that or after that. And then Bill 124 came into effect, and we've been further held back. And, it's just overwhelming disparity, because the nurses are leaving. They're depressed. There's a huge amount of mental health problems and anxiety. And I don't know, do you see, there's a lot of anxiety, and this is not exclusive to nursing. I think it goes from housekeeping, midwifery. There's anxiety about, and maybe it's just the times. I'm sure that the times of living through COVID-19 is anxious enough. But when you think that you've not had an increase in your wage and you're being hit and capped, then at some point you look at going to Alberta. There's 2 registered nurses from Etobicoke that left and went to Alberta and have settled in there. Property value is a lot less in the area that they settled in, and they're being paid more. And so they feel really valued and a part of their community. So you don't want your nurses leaving. Like in 1990, when I graduated, almost a third of my graduating class went to the States, and it was part of this brain drain that continued for a long period of time. And it was hard to catch back those nurses, because they ended up marrying Americans and staying in America and having their careers down there. So we want our nurses to stay here. We are short 22,000 nurses. We can't afford to have any more leaving. So we need to honor the most noble profession that I've been told. I've had patients, and they constantly reaffirmed that I made the right decision in my vocation, that have lifted me up and said, but you're in the most noble profession. And it warms me up, but it doesn't pay the bills at the end of the day, right? We need a government that acknowledges it as well.
But it sounds like the bill piece is part of it, but it really translates into a lack of respect, is what I'm hearing. Brenda, can you comment?
Yeah,
I gotta
17 years. So if you look back over my career, you can look, and there's a pay scale that I will give you so that you will have an actual copy, and it shows the difference in wages for nursing. So nursing to firefighting, I think when I look back, it was 94. We were in the 95, 94 percentile of what they were making. We're now 80%. So there's now 20% difference. So they're making like 125 and we're making 95 to 100.
Right. And that's not to berate them or anything like that.
No,
it's to make the comparison.
We're worth that too.
Yeah.
I want a seat at the table. I think we need to acknowledge that nurses are 4 years degree at university, not coming in with a lot of debt, working in an extremely high pace. And like Brenda said, no downtime. There really is not downtime. And now if you're not working, miss meals, we leave late,
Right.
and we do it because that is our job, when we are bound by our as nurses to care for the sick, and we can't leave our post, but we need to be paid accordingly.
Tammy, just to that point, we do have a question, Dave, later
okay.
that came from audience, but I want Brenda and Carrie to finish.
Yeah, thank you.
To sort of add into that, but I do have a question, Tammy, about that whole, having loans and stuff. So, but sorry, Carrie and Brenda, I think you wanted to hear.
Thanks, Sonia.
Yeah, I mean, I can add in about the lack of respect. I think my impression is that there's a lack of appreciation, and I don't mean an lack of understanding about how highly skilled the hospital professionals are, from nursing through to all of the regulated professionals and unregulated professionals that I represent. I mean, they go to school for quite some time. They have specialized knowledge, and pay equity has definitely not kept up. I can only comment that, at least for OPSU, like we started the process of pay equity 10 years ago, and it's sitting with the commission. So, if you can do anything about fixing the pay equity commission and moving things along, that would be great.
And they haven't filled the seats in the pay equity commission, isn't that right?
You could be right.
I think they said, well, they can't meet because they don't have enough members, and yet they control the members. I know they've done that for other committees. So
yeah.
Okay, go ahead.
But I feel like, again, I think in healthcare it's female dominated, and I think that the women that bear the brunt of our healthcare system are not seeing the proper recognition financially. We need to get rid of Bill 124. We need to have proper negotiation ability, and we need budgets that allow hiring and staffing properly in the hospital sector. And the stress that came along with this pandemic, if I can just add, I mean, from the very beginning, I mean, we're dealing with a female-dominated profession. We were told at the beginning, oh, you don't need a mask, don't worry, unless the patient's COVID positive, don't you worry. I mean, we knew it was because there was no PPE, and we got that. But from there, it was, the stress of, okay, now my childcare is closed. Now, how do I work, and how do who's going to care for my child, and my elderly parents, are they able to provide care? And then it went to, okay, now we're getting sick with COVID. I'm part-time. How am I going to get paid? Am I going to be home without a paycheck because I went to work and I got sick? So it's been one thing after another. Keeping up with the constant changes throughout this pandemic has been exhausting to the members, to the frontline staff and the healthcare workers. It's been exhausting just trying to keep up from a day-to-day perspective about what does tomorrow bring, and what will it look like when I go to work. And so, yeah, we're here, 2 years in, and people are really burnt out, really tired, not getting the vacation they need, not getting sort of that security net of knowing what their schedule is going to look like, right? Just so much change day after day.
Thank you very much for that. What I see the question. Thanks so much, Sonia. So we got about we have about 10 minutes or so left, I think. I wonder if we can do a rapid fire or something on the concept of privatization. There have been some that have said that, well, this is happening and it really pushes folks to say, I can't get my test, I'm going to go over to the States or something, or we need other clinics, private clinics. And I think the still current but going to be former Minister of Health, Minister Elliott, had said something at a press conference talking about privatization. So Brenda, you're nodding your head there. Can you give us a couple of minutes here on privatization and your thoughts on that? Yeah.
Privatization is the worst possible way the government could go. I mean, as Canadians, we value our public healthcare system, but we definitely do not have the resources to staff a public system and a private system. We're just going to create a two-tiered level where certain people can go through quickly and get the care they need, while other people are left waiting forever for their services. But the reality is we just don't have the healthcare staff in Ontario to support two systems, nor is it, to my knowledge, nor do we want it, right?
No, of course not.
I
it
grew up on
appears
the
that
pillars of
folks are going that
healthcare.
way.
Like,
Yeah,
yeah,
yeah.
I don't know how they're going to find the staff to do that.
Hmm. Right.
And if they're going that route, are they doing it to dismantle public health care in Ontario because and attract them with higher wages in the public sector? I don't
Yeah,
know, but
yeah.
you can't. It's like having the express line at the grocery store. The other lines are lined up
Hmm. Hmm.
and
And
backlogged.
Carrie, you were saying that you can't, as midwives, you can't hire midwives. You can't find them. There's burnout there too. Does privatization affect the midwifery profession as well?
You know, I think privatization would affect any
Hmm. Hmm.
everybody really. And again, what Brenda touched on, that two-tiered system, and just socially, is that something that we want to head towards as a
Yeah.
community? Personally, I don't.
Yeah.
It's not something that I fundamentally believe in, so that obviously I have issues with that from the
Well,
core.
and absolutely, the NDP is obviously opposed to that, but it just seems like this government is moving in that direction. And like I said, the minister mentioned it at a press conference a couple of weeks ago, and everybody, oh, the cat's out of the bag. Well, I think a lot of folks would have seen this coming, that they were trying to dismantle things, unfortunately, and not respecting workers and healthcare workers of any stripe. So. Tammy, anything on that
Yeah,
quickly?
well, I'd like to add, I believe that the privatization, it's going to be an elite access only, obviously.
Hmm. Hmm.
We don't have the staff to man that type of operation. We
Hmm.
need to keep our publicly funded education or healthcare system intact. And we need to raise it up into the standard that we were once at, with our staffing ratios, safe ratios. You're just not going to get, often Hamilton Health Science and the cardiology department, they're some of the best doctors. They're internationally known. And when sometimes you go to these smaller centers in the States, you can get the services there, but it's not the expert quality that you want to have at a big center, like at a big center like Hamilton or Niagara Health. You don't want to have all these smaller places cropping up that are not publicly funded or that are privatized. You want super users, experts in the field, in your active hospital settings. And you just want it to be properly funded so that the managers can hire the staff, so the staff can do the jobs and the patients get the service.
Hmm. Thank you very
And
much.
if I can just
Yeah,
add, you
please.
don't
Yeah.
want a private system
No.
where potentially you're going to be upcharged for things you don't need. And we know that we saw that out
Absolutely.
west, and with less regulation. And
So
yeah,
explain that. Is that like tests that you don't need and they would charge it because they can do an upcharge on it, that kind of thing?
yeah, or you need, like, you're going in for cataracts, and we've got this super cataract lens. It's way better, and
Hmm. Hmm.
like, it's not what you need, but you kind of feel, who doesn't want the best, right? Like, you play on people's emotions, and all of a sudden people are paying extra fees for things that they don't need in that
Right.
that
Right.
procedure, right?
Hmm.
Yeah, it
I've
just,
heard some of that happening actually currently, right? And maybe that's why you're using the example.
yes.
Wow. Okay. Well, thank you so much. We do have a question here. So my son is going to nursing, but is concerned that he won't get paid as much here as he will in the United States. What can the NDP do to make sure he doesn't leave? Sonia, is the next question part of the same one, or no? It's a second
No,
question.
those are two separate.
Okay, thank you. Well, I think, as we're hearing, there's definitely a need to invest in healthcare. We saw, for instance, that the government, in a report that just came out last week, budgeted money for healthcare, and budgeted money for other things in the province up to, and didn't spend $5.5 billion before the end of the year. So when we're all looking for rapid antigen tests, when healthcare workers were having to cancel vacations and realizing and saying that they're not being valued, when there's maybe even tests that weren't done when people needed them, that's because this government made a choice, and they determined, and they said, we're not going to invest in healthcare. We're going to hold on to that. Now the suspicion is that they're using that to do all these quote unquote goodies to make them look like the good guys. But if you look at some of the goodies, there's a article, it was just in today's paper, an opinion piece in today's paper by Randy Robertson with the Ontario Directorate of the Canadian Centre for Policy Alternatives, who said that the sticker license fee could hire 12,000 nurses. We heard we have a backlog of 22,000, but that sticker scheme plan stunt could hire 12,000 nurses. So
Wow.
the NDP is committed to investing in healthcare, to investing in healthcare workers. And that's what I'm seeing, because very often we think about healthcare, we think about, I'll say, bricks and mortar, beds and hospitals. But as we're learning tonight, and I really appreciate everyone sharing your perspective and your experience, it's about the healthcare workers more so than the bricks and mortar, because there's money for that, and they're announcing that. So we have this beautiful facility in St. Catharines, and we're going to be renovating one close by and one in Niagara Falls, and yet will we have the workers for them? You know, that's not the case. So the NDP is definitely committed to that, to investing in healthcare, and you know, with these stickers, for instance, what would you rather have? Would you rather have to pay for a sticker, or would you rather have a nurse when you needed it, right? As the writer writes, he says that that sticker every penny pays for a nurse when you think about it, for that $120. So that's a lot of pennies, but it's a huge investment.
It adds up.
It adds up.
Mhm.
Yeah, thank you. The other question, and then I think we're gonna wrap up here. Says, since the 1990s, the Ontario government has been balancing their healthcare budgets on the back of healthcare workers. The question says, Conservative, Liberals, and NDP, if the NDP are elected in June, will they repeal Bills 124 and 195 to improve working conditions and collective bargaining rights for nurses and other healthcare workers? Absolutely, Bill 124. Bill 195. What's Bill 195? Help me out here. I think Tammy, you
That
mentioned
was
it, right?
actually, Brenda might want to talk more about that, the specifics, but that was the ability for the hospital. Am I right, Brenda?
It was, yeah, we all
Bill 1
we all fumble, right? I believe that was the bill that went through that took away some of our bargaining rights and the right to scheduling. Like,
Right.
so
you
it
could get called
basically.
in.
So will 124 is wage suppression, and 195 is bargaining rights. Removing both of those, right?
It had Bill 195 had a lot to do with the ability, basically, to tether you to the hospitals because of the crisis that we were going through with the pandemic. So denying vacation, increasing your shift times, and just it really took away almost any humanity to the workers. That, you know, not looking at us. You know, I worked with an MRT, and we're constantly asked to work late, and my daughter's older, so I don't have anything pressing to get home to, but people have to look that they have kids in childcare. You cannot leave your child unattended, you know. And I remember once being in an ambulance, particularly, and there was a snowstorm, and they didn't call it early enough, and they called it in at noon, and I was, as it happens, just happened, very fluke, I was on my way with the patient to Hamilton. So I couldn't get to my daughter. And, you know, it was such a feeling of helplessness in that one instance. So I can only imagine that this Bill 195 does that repetitively to the worker in the hospital setting. Thank you.
So to the person that asked the question, yes, absolutely, we will repeal those bills. Both of them, now that the 195 has been explained. And the central theme that I think we're feeling here is a lack of respect. I mean, when someone says that, when workers say they're undervalued, and when, you know, Brenda, who sees so many workers from different perspectives within it, is saying that, and that healthcare workers feel invisible. And here we are, we say that your health, you know, I don't even want to say it because it's been a mantra, healthcare heroes, and yet you're really feeling, you know, invisible, like a zero, Like, that is absolutely horrible to be treated that way. And that's the piece. So in terms of appreciation of healthcare workers and the important work that's done, obviously investment in those workers is key, and involvement and allowing workers to help decide and say, look, if I have a vacate, because I'm going to burn out. And I think the public, if the public learned that that was going on or knew that that was going on, I mean, COVID was so impactful on folks. But if we stopped and thought about it and said, wait a minute, that person that's providing care, they can provide, you know, even better care if they were able to take some time off, that they weren't burned out, that they were respected at the workplace. And so I think this discussion tonight helps so many people that just don't have that involvement like you do, each of you do in the healthcare system, to really understand the nuances. I was with somebody on Twitter, and they were back and forth about Bill 124 a couple of weeks ago, and trying to explain, but you did explain it. It's not just about the wage suppression, and it's about the respect, and it's about the involvement, and every one of us wants that. And it's about the comparison, the pay equity. I think Carrie was the first to say that. It's about the comparison with other types of professions. And so each of you, thank you so much for explaining your profession and also your experience. And it's just tremendous. I hope that folks who are watching got as much out of this as I did, and Sonia did. And
I have one other thing to add, Dave, if I
I
can.
just want to say that, sure, go ahead.
Okay, it's just
I don't want to cut you off, anybody off.
The general population, and I don't think you know, and I'm sure Sonia doesn't know, after the 8th year of practice, nurses cap, our salary is, we reach our maximum at our 8th year of practice. And so from the 8th year, for 17 more years of nursing, we don't have any more increments in our pay scale, where police and fire continually have, work their way up the ladder, and the pay grid was created by someone that cared about them. And I think we need to reassess that, and we need to reassess that seriously, because who works for 17 years without moving up the ladder? In what industry? Who in their right mind would stick around? Why won't I go to medical devices? Why wouldn't I go become a pharmaceutical rep? You know, where I'd get paid and rewarded according to my years of service and knowledge base. So we need to look at that. That's something that has to be addressed, and it's the elephant in the room for many nurses, for sure.
But I think, so thank you very much for explaining that. But I think people, no, it's great. But I think people just looking at that at face value say, oh, well, they just want to be paid. No, it's, of course, everybody wants to be paid, but and compensated appropriately, especially when you compare to other sectors or other professions out there. And that's what you're asking for. And that will help with things like burnout and folks leaving and folks coming in, right? Why would you want to enter this profession if you know that's how you're going to be treated? Why wouldn't you look at something else? And so the backbone, the very backbone of our healthcare system, healthcare workers are being disrespected. How can we even think that it's going to be there for all of us when we need it, right? If you're not being respected, if you're not being paid appropriately, if you're not being appreciated. So thank you so much for explaining that. 3 seconds about the NDP. The NDP is committed to investing in healthcare, and the choices that this current government has made, the NDP would have made different choices in terms of the investments. The license sticker fee is just one example of that. The dollars are there. The dollars are there. It's just the choices that the government is making to build highways over healthcare workers, to do stickers and things like that, and little gimmicks, and look benevolent with this $5,000. Yeah, you should take it, but let's repeal Bill 124 and Bill 195. So I just want to let folks watching know that. Thank you so much. I know we could go on for hours.
And your seat is so important.
Yes, it is. Yeah,
so your seat is exceptionally important for nurses, and I want you to win. You have to win.
with
Well,
your
we're
help,
just going to do it.
we
we're
can
just
win.
gonna-
With your help, we can win.
Yeah.
Sonia, I
gonna
think is
do
going
it.
to talk about that. Sonia, I'll turn it
Yeah,
back to you.
about
But
how-
once again, let's, I mean, at
how
home,
we
if you're
will.
at home, Carrie,
Absolutely.
Brenda, Tammy, thank you so
Thank
much
you.
for this. This is, thank you.
You're
Sonia,
welcome.
I'll turn it over to you.
Yeah, absolutely. And we could, I mean, such a massive issue and has been an issue for so long. I mean, education and healthcare are always the two top biggest things that come up with elections, right? But certainly healthcare now, with going through 2 years of a pandemic now, on the back of everything else that's been falling apart and hasn't been addressed. So Dave, thank you very much on behalf of everybody who has supported you so far, is supporting you, and will be supporting you, because this is a big undertaking, but a really important one. And you're clearly very credible, capable leader to be doing this. So thank you for doing that. Brenda and Carrie and Tammy, thank you for taking time out of your busy schedules and providing some great energy and discussion tonight. We could talk for years about this, or at least months, because then we talk about it and do something and solve it, right? Because we don't want to just keep talking.
Time for talk is over. It's time for action,
time
right?
to talk.
Right.
Let's
It is.
do it.
Yeah.
Let's
No more
do
lip
it.
service. We need action.
No,
Right,
and that's what Dave I know is hoping to do in Niagara West.
Yeah.
This is going to be, we have been recording this, so if anybody is just catching us now, or if you would like to share this later on with many people, this will be on YouTube, and we'll post the links there on Facebook, Instagram, and Twitter. And Dave West Run Association as well for NDP. We do have more roundtables to come, so we are going to also be discussing just small topics like this one: education, the environment, affordability, just little things. So we will certainly be having a good focus on those, and some other fantastic guests as well, like yourself. So thank you for that. We are, I am going to plug Dave in terms of if you do want to support, so anybody who is watching, if you'd like to support Dave, we have a youth committee. We have a communications committee that needs help, and Dave walks every single weekend. So he's out there campaigning on Saturdays and Sunday afternoons. Niagara West is a big riding, so there's a lot of steps you can get in. And if you don't want to walk and talk, you can also just walk, and you can just drop off flyers in people's doors and mailboxes. There's lots and lots of different ways everybody can contribute, from young. So we've got actually somebody who's in grade 10 right now who's on the youth committee. And so he's 15 and he's involved and he's on fire. And we have, well, we won't mention who's at the other end of the scale, but there's lots of opportunities. Everybody has a seat at our table, from any background, any experiences you have, any sectors of work, anything. So, so we're looking forward to people joining us, and we welcome absolutely everybody, because everybody's voice is important in this. And Dave is looking forward to talking and listening as he did tonight. And I know you were taking notes, Dave.
I have like 3-4 pages of notes here.
I know. His head was down. He wasn't texting his wife or anything. Dave taking notes on everything. See, there it is, right there. So he's a powerhouse. What can we say? He's always on fire. So we have lots of things coming up. We do have a fundraiser trivia night, which is March 25th. And all sorts of things will be posted on Dave's social media pages. So Facebook, Twitter, and Instagram, and we'll add those links when we also post the video. So thank you again very much, ladies, for coming out on International Women's Day. Hopefully you've had a nice day, and we're going to have a really good year, especially after June 2nd, I think. Hey, Dave?
That's right. Absolutely.
Yeah,
thank you so much to each of you. Thank you, Sonia, for putting this together. Thank you for technical support for solving our problems.
Yes,
thanks,
thank you.
and thanks everybody for watching. Please, send us your links and send us feedback as well. Thank